What's a coma? Definition: a state of unarousable unresponsiveness. Describes the level of consciousness in terms of response to the various levels of stimuli, and patients with only reflexive responses may still be described as being in a coma. So the reflexes could be intact, but still will be in a coma. Maybe due to diffuse cerebral insult or to focal processes. Examining the possibility of comatose patient. We have say, yell, patient's name, verbal stimulation. Shake, tap, this is tactile stimulation. Press or patient's nail beds, and this is peripheral painful sensations or stimulation. Sternal rub or nasal swab, we call this central painful stimulation. And if these tests fail to reveal a response, your patient is possibly in a coma. The brainstem exam is done to determine if the brain death is present. Remember, you ask yourself, how awake is your patient if you're thinking about level of consciousness? At this point, obviously, functionality has been lost, not cognition. Cognition has been lost. So what are some of these brainstem reflexes that we're paying attention to? Remember, please, the pupillary light reflex, the afferent, referring to optic nerve, is going to then take in the stimuli of light. And the efferent is going to come way of oculomotor, parasympathetic, therefore causing constriction of a pupil. Your brainstem functioning, pupillary light reflex. We have known as the oculocephalic reflex, or doll's eye. And with this, the afferent here is going to be your 8th cranial nerve, which is your vestibulocochlear. The efferent would be through your oculomotor, and then you have your trochlear and abducent, all in the form of your eye, in which, if you have oculocephalic with doll's eye, then everything should remain within stable or balanced. You have a corneal reflex. Here, literally, you're going to touch, and so the afferent would be through your trigeminal ophthalmic branch, and then with the closure of your eyelid, that would be from your facial, your corneal reflex. You touch your cornea, and then there should be blinking. The gag reflex, afferent, would be through your glossopharyngeal. Take a swab or whatnot, touch the back of the throat, and then the efferent will be through your vagus. These are all important brainstem reflexes. Remember, please, at this point, you're going to try to figure out as to whether or not brainstem functioning is even intact or not. Coma. Now, the brainstem reflexes, or the cold calorics. What happens here? 50 milliliter ice water injected into the ear, for example. Cold is an inhibitory stimulus to the vestibular nerve. The vestibular nerve projects to the contralateral 6th cranial nerve, or abducent. Normal response is slow deviation eye towards the side of the cold water, then a fast return to the midline. And that portion is your nystagmus. So towards the cold, and then a fast return to the midline. In coma, remember here, we're talking about the cold caloric, or we talked about the doll's eye reflex. We have the 8th cranial nerve. And along with this, the pathways are intact. The eyes tonically deviate toward the cold stimulus with no fast phase. In coma, there's no fast phase to come back to the midline. Remember, primitive brain looks to stimulus. Higher brain brings eye to the midline, and that is what is lost, please, in coma.